A 21-year-old steelworker has arrived to the ER after falling in a seated position onto some rebar at a work site. His co-workers immediately helped him up and called the ambulance. Upon arrival of the EMS, the steelworker tried to rise and walk to the ambulance, but immediately reported having difficulty getting up from his seated position. Which nerve was affected by the injury? For this question, we're looking for the inferior gluteal nerve as the correct answer. This nerve supplies gluteus maximus, the power extensor of the hip joint, so it assists you in getting up from a seated position or also going upstairs, which are going to be red flags for tagging that muscle and that nerve. The superior gluteal is going to be gluteus medius and minimus, as well as tensor fasciae lata. The tibial nerve will do posterior compartment of the thigh and go on down into the posterior leg and foot. Obturator is medial compartment, and the common fibular is going to be supplying both lateral and anterior compartments before it has divided. A 62-year-old male patient complains of burning in his legs upon walking, which forces him to stop after only a short while. He can continue after a few minutes of rest. The Doppler ultrasound reveals a near complete blockage of the femoral artery just distal to the inguinal ligament, within the femoral triangle. What vessels could provide blood flow around an occlusion of the femoral artery at the stated level? For this type of question, think backwards one spot from where the blockage is. So this is a femoral artery block just at the inguinal ligament. Therefore, if we go back one level, we know that we're at the external iliac. Therefore, we're looking for a branch that would be off of the internal iliac. The inferior gluteal is the answer we're looking for in this case because it's the largest of the branches off of the iliac. It does that through the cruciate anastomosis that you need to be familiar with, but all of the other branches are going to be either too small, such as the obturator, and not part of the cruciate anastomosis, and the others will be distal to the blockage and therefore not useful as a bypass.